You know, for the longest time, we've all thought of liver cirrhosis as a one-way street, a kind of irreversible endpoint. But what if that's just not the whole story anymore? In this explainer, we're going to dive into the truly groundbreaking shifts in how we understand, diagnose, and now even reverse the most advanced form of liver disease.
So, let's just kick things off with a question that really gets to the heart of this whole revolution. When you picture liver disease, what comes to mind? For most of us, it's probably alcohol. But the science is telling a totally new story. And it turns out the main driver of cirrhosis for millions of people is actually hiding in plain sight.
And that leads us perfectly into our first section. We've got to start here because the very language we use to describe this disease has completely changed, and for a really, really important reason.
Look, this is so much more than just a name change. We've gone from NAFLD to MASLD. The old name was what we call a diagnosis of exclusion. It only told you what the disease wasn't, fatty liver that's not from drinking. But the new name, MASLD, directly connects the dots between liver health and our overall metabolic health. And that shift in perspective is absolutely crucial.
So, what does MSLD actually mean? Well, it's now a positive diagnosis. To have it, you need two things. First, fat in the liver. You got to prove it's there with imaging or a test. And second, you need at least one of 5 risk factors tied to your metabolism. Things like high blood sugar, high blood pressure, a larger waistline. You get the idea. This finally puts the liver right in the middle of a much bigger conversation about our systemic health.
And this is exactly why that change is so urgent. This silent epidemic, it's not being driven by viral hepatitis or even just alcohol anymore. It's metabolic dysfunction, the kind that's driven by our diet and lifestyle. And that is now the #1 rising cause of severe liver scarring on the entire planet. This completely reframes the public health challenge in front of us.
Okay, so we know what's causing the injury, but how does a healthy liver actually end up scarred? Let's break down the biology a little bit.
At its very core, cirrhosis is basically wound healing gone totally wrong. See, the liver is incredibly resilient. It tries to repair itself after it gets hurt. But when that injury is chronic, it's happening over and over again for years, that repair process just goes into overdrive, and it starts replacing healthy, working liver cells with useless scar tissue.
And this whole destructive process follows a pretty predictable path. It all starts with injury and inflammation. That wakes up these specialized little cells in the liver called stellate cells. Once they're activated, they start pumping out massive amounts of collagen, which is basically scar tissue. This process, it's called fibrogenesis, and it completely distorts the liver's entire architecture, which eventually leads to a really dangerous plumbing problem. And this is the key takeaway right here. All that scar tissue acts like a dam, making it super hard for blood to flow through the liver, so it backs up. This causes a huge increase in pressure in the main vein that leads to the liver. It's a condition called portal hypertension. And this one complication, it's the direct cause of almost all of the most life-threatening symptoms of cirrhosis.
For years, the only way to actually see that scarring was with a pretty painful and risky procedure. But that is changing, and it's changing fast, thanks to a revolution in how we diagnose it.
Yeah, the old gold standard was the liver biopsy. A doctor would literally stick a long needle into your liver to pull out a teeny tiny sample. Not only is it invasive, but it's kind of like judging the health of an entire forest by just looking at a single leaf. You could so easily miss the scarred parts and get a completely wrong picture of the damage.
But now there's magnetic resonance elastography, or MRE. Instead of a needle, it uses these low-frequency vibrations and an MRI to measure the stiffness of the entire liver. It's pretty cool. A soft, healthy liver jiggles easily, while a scarred cirrhotic liver is stiff. The experts are all in agreement. It is the best non-invasive tool we have, period.
And just take a look at the data. This table compares a few of these non-invasive tests. The numbers you see, the KPA, that's just a way of measuring stiffness. And a score over 5.0 on an MRE is a super strong indicator of cirrhosis, which is that most advanced stage F4. This kind of precision lets doctors track the disease so much more accurately and safely. It's a real game changer.
Now, this new understanding isn't just about high-tech diagnostics. It's also completely transforming the practical advice we give to patients, especially when it comes to something as basic as, food.
You might find this hard to believe, but for decades, patients with cirrhosis were told to restrict their protein intake. The fear was that protein could create ammonia and lead to confusion, or what's called hepatic encephalopathy. Well, it turns out that advice wasn't just wrong, it was actively harmful. The new science is totally unequivocal. Patients with cirrhosis need more protein to protect their muscle.
And here's why this is so incredibly important. A cirrhotic liver just can't store energy very well, so the body goes into this state of accelerated starvation. And to get fuel, it starts breaking down muscle tissue. This muscle wasting is one of the single strongest predictors of death in cirrhosis. So what's the best way to build and protect muscle? Protein.
So, the 2025 guidelines completely flip the script. They recommend a high protein intake, telling people to focus on plant and dairy sources. They also say to eat small, frequent meals. And get this, they even recommend a late-night snack. This helps prevent the body from entering that muscle-burning state during the long overnight fast. The message could not be clearer. Do not restrict protein.
Okay, we've talked about the new cause, the new diagnostics, and the new diet. But now we get to the most exciting part, the first real, hard evidence that we can actually turn back the clock on the scarring itself.
I want you to focus on just one number, 24%. This number comes from a landmark clinical trial for a new drug called efruxifermin, and it represents the percentage of patients with the absolute most advanced F4 cirrhosis whose scarring actually improved by at least one full stage.
The lead researcher on the study, Dr. Mazen Noordine, he put it perfectly. This isn't just some small improvement. Moving from stage F4 to stage F3, well, it means that, by definition, these patients are no longer considered to have cirrhosis. This is a change that, for a long time, was thought to be biologically impossible.
So, what does this all mean? It means we are witnessing the dawn of a completely new era. The idea that cirrhosis is a permanent, irreversible condition, well, that's being challenged by hard clinical data. We now have proof of concept that a medication can actually make established, dense scar tissue regress.
Which, of course, leaves us with this final, tantalizing question. We've gone from believing that cirrhosis was basically a death sentence to proving it can be reversed, at least in some patients. The journey is far from over, but for the first time in medical history, the answer to this question is looking more and more like yes.